questions answered. So this is for people who are maybe skeptical about chiropractic, maybe have questions. What is chiropractic? What does it do? The person who maybe thinks like, hey, I've heard it can help people. I heard it might hurt people. I don't know what to believe. We want to answer all your questions this evening. So my name is Dr. Nixon. I'm a holistic chiropractor here in Winston-Salem, and I'm thankful and excited to do this with you guys. My wife and I opened a practice about almost 8 years ago now in Winston-Salem, really just with a mission and a vision to see people experience their God-given health potential. And so we're excited to walk through this with you guys this evening. So first things first, I want to show you guys this medical disclaimer. This is, it hopefully goes without saying, but I want to make sure it happens. This is not meant to replace your doctor. This is not meant to, I'm not here to be your primary care physician. This is not medical advice. I'm not diagnosing anything. I'm not treating anything. We're just talking about options, options for your health, any health concerns or questions that you might have. So we're gonna walk through that together. I will say this off the bat, my wife is, there's my wife right there, and my son, Lincoln. I love that. I love him so much. I love both of them so much. But one of the things for Marissa, she would call herself a chiropractic skeptic, maybe just a skeptic in general, but definitely a chiropractic skeptic. When we were dating, we started dating when we were 17. And we started dating when we were 17 years old. And when I started chiropractic school, we would have conversations about chiropractic, the spine, the nervous system, all that stuff. And we'd have so many arguments and fights. I was so bad at communicating. I was so awful at communicating chiropractic at all. We had so many arguments, but she was the biggest skeptic, which was really good and I think healthy for our conversation. So any of the questions that you have about chiropractic, I promise you, she has asked them already. And so we want to be super transparent. One of our values in our office is just transparency. So we're not trying to blow any smoke or anything, just really trying to give you guys the honest answers, the truth. We don't pretend to heal anything and everything. That's not what we're trying to talk about tonight. What we're trying to talk about is options. I really do believe the best doctors in the world are the ones that can help their patients understand cause. Because if you can understand the cause of a health issue, you can make symptoms go away. But if all we do is treat symptoms and we never get down to the root cause of an issue, a lot of times we just never get better. So we want to talk about cause instead of symptoms. So let's hop into it. I think one of the first things we want to talk through. That's me as a little guy. That's my folks, my mom and my pops, and my dad. He really is the reason I do what I do. I'm so thankful for his health journey and what he went through. But he's the reason I do what I do. So long story short, my pops in his mid-40s, out of the blue, had a massive heart attack. And at that point in his life, he was on 0 medications. He wasn't on any, he had no diagnoses. And out of the blue, has a massive heart attack. They rushed him to the hospital. They saved his life. Thank God they saved his life. When he left the hospital, they said, "Here, Mr. Nixon, are your medications. High blood pressure meds, high cholesterol medication, and a Vandia for diabetes." Right? And so we know this, whether you're on medications or not, we all know drugs and medications, they always come along with side effects. So he gets them, headaches, episodes of depression. He would have a massive mood swing. So he goes back to the doctor, and guess what they gave him for that? They said, "Hey, well, here's a headache medication, here's a depression medication, and take this for anxiety." So he starts taking those medications, and those have side effects. And within 6 months later, my dad has another heart attack, back in the hospital again, and again they saved his life. I want you to understand, I am not anti-drug, I'm not anti-medication, I'm not anti-doctor. We have the #1 emergency care, bar none, in the world, but we have one of the worst healthcare systems. And again, we're really, for my dad, they saved my dad's life twice. We're really good at saving people's lives, but a lot of times the solution is to just put them on a medication for the rest of their life. And that just didn't work for him. So after his second heart attack, he's like, all right, I've got to do something different with my health. It was a big just light bulb moment for him. And maybe you've had one in your life or with your health. But he had a light bulb moment. He's like, okay, if I want to be around for my family, if I want to be there for my kids, I've got to do something different with my health. And so my dad did. He took the next 12 months. He changed the way he ate. He changed the way he moved. He started taking care of his nervous system. Within 12 months, my father reversed every single diagnosis, got off every single medication. I got my dad back. And I'm so thankful for that. Now he's around. We have a son. Like I showed you guys earlier, his name is Lincoln, and he's around for that, and it's amazing. I'm so thankful for it. So then fast forward a couple years later, I was down in Orlando, Florida, going to UCF. I was doing kind of the pre-med course and doing science stuff. And I remember sitting down with my dad one day, and we were shooting the breeze, and he asked me the question, for any of you guys who have kids out there who are college age or younger, you'll at some point, maybe you'll ask them this question. So my dad asked me the question. He goes, what do you want to do when you grow up, right? What are you gonna be when you grow up? And really, my dad was saying, hey, when are you gonna, get out of my house? When are you gonna make some things happen? And so I told my dad, I was like, hey, I think I want to be a doctor. I like science. I was always kind of good at it in school, and so I think I want to be a doctor. And my dad said, man, awesome, that's great. And then he said, why? And I told him, I remember telling him, I want to help people. For anyone out there, my doctors, my nurses, my teachers, the only reason people get into these professions, really at the heart of it, is we just want to serve. We want to help people. And so I told him, I want to help people. He goes, that's great. That's awesome. And he said, look at me. And he said something to me that forever changed my life. He goes, the thing that helped me the most, this is when my dad was going through his health crisis. He goes, the thing that helped me the most is when someone sat me down, taught me that my health was important, my health was valuable, but most importantly, that I was the only one responsible for it. Because that's the truth, isn't it? There's only one person who's responsible for your health. Who is it? It's you. It's me. We're the only ones we're the most responsible for our health. I'm so thankful to have an amazing wife, and she helps me be responsible for my health, and she encouraged me. But at the end of the day, I'm the only one who's responsible for my health. So here's the deal. If you want to know what health is, and I know you do, and I do too, if we want to know what health is, right, or if we want to be healthy, we got to start with understanding what health is. I think more important, let me go here. So instead of teaching you guys what health is, let me teach you what health is not. So this is where a lot of people get into trouble. Think about this. When your kiddos get sick, or our kiddos get sick, or we're sick, or whatever the case may be, if someone gets sick, the most common place someone goes to is where? We go to the doctor. We go to urgent care. We go to the emergency room. We're going to go to a physician. And a lot of times we walk in, they'll do some testing, they'll ask some questions, they'll do some blood work, and a lot of times we end up with a diagnosis, right? So here's the diagnosis, here's what it is. And then before we leave, oftentimes the solution to the diagnosis is we say, hey, here's a prescription medication, go home and take this, right? So again, the prescription medication, the medication's job is designed to cover up a symptom. So we go home, we start taking this, maybe it works, maybe it doesn't. So let's say it doesn't work. I got a prescription, it's not fixing my issue, so I still have issues. I go back to the doctor, he runs some more tests, and he sends me home with another medication. Right now, if that one doesn't work, I still have the problem. Now I'm thinking to myself, okay, I'm done with that. That's not working. I'm going to go find a different doctor. I'm going to go find me a special doctor. He's called a specialist. He's going to run you a special test. He's going to send you home with a special drug or medication. Now, again, if that one doesn't work, now you're in trouble. And now you'll hear stuff like, maybe you need to talk to a surgeon. Maybe we need to run more extensive MRIs or more testing. We don't know what it is. Maybe, I've heard this one before, maybe it's just all in your head. Have you tried depression medications recently? Right? We don't know what to do to fix you. Right? But here's the problem with that process that I just walked through. Oftentimes in our culture, in our country, we call that our blank care system. Right? When you fill in the blank, we call it our health care system. Test, drug, special test, special drug, surgery. That is what we call our healthcare system, but that doesn't sound like true health to anyone hearing this. It doesn't sound like vitality. It doesn't sound like health. It doesn't sound like me being around when I'm 95 years old, right? So it's just like, okay, that's not health. I don't want that, but I still want to be healthy. And again, I want you guys to hear me loud and clear. I am not here to beat up doctors and nurses. We have amazing, incredible healthcare providers. The problem is not the people. The problem is the system. Right? Again, we have the #1 healthcare system, and we have the #1 emergency care system in the world, but we have one of the worst healthcare systems. We're really good at saving your life, but then the problem is we put you on a medication for the rest of your life, and it doesn't actually make you healthier. So it just begs the question then, question #1, what is health? What is health? If someone were to ask you the question, how do you know you're healthy? Right? How do you know you're healthy? The most common answer to that question is I wake up in the morning and I feel what? Good. If I feel good and I feel fine, then I must just be fine. My dad used to say it this way, if it ain't broke, don't fix it. If you feel fine, then you must just be fine. So what happens is we wait till we feel bad enough, and then we'll go to the doctor, and then he'll prescribe us the next drug or pill or medication or antidepressant to make ourselves think we feel better. But if we don't actually fix the root cause of it, we don't get better. We all keep getting what? Worse. That's not health. So I'm going to teach you guys what health is. You ready? Draw the word out in your mind, or just look right there. The first 4 letters of the word health spell what? You got it. It's heal. Here's the difference. And I remind my patients all the time, health, it is not based on how you feel. I want you to feel good. I want you to feel wonderful. Part of my job is to get you feeling better, but you will not base your health simply and solely on how you feel, right? Health, it's actually based on how your body heals, or more medical terminology, how your body functions. Health, it's actually based on how your body heals and how your body functions. So then the next logical question is, all right, Dr. Nixon, if health is based on how I function, what controls the function of my body? So now we go back to Anatomy 101 in 6th grade. And y'all remember 6th grade? It was a little bit ago, a lot of bit ago for some of us. So science question #1. The way your body works, the way God built it, the way God put it all together, there's one organ, only one. Don't get this wrong, no pressure. There's one organ in your body that makes all the other organs work. What is it? What is it? Good answer. Good answer. It's your brain. It's your central nervous system. So it's your brain attached to your central nervous system. So the way Anatomy 101 is this: your brain sends a message down your spinal cord, out your nerves, and it tells things to work. It tells your heart to beat. It tells your lungs to breathe. It tells your digestive system to work. It tells your pain to leave you alone. When your body is functioning closer to 100%, we see the organs work how they're supposed to, and we don't see the aches and pains. This is what we want. What we don't want, or the problem that happens, is when your brain sends a message down the spinal cord and the message gets either blocked, maybe gets diminished, or interrupted. Right, blocked, diminished, or interrupted. The way that happens is when your spine, the bones in your spine called your vertebrae, when those guys move out of alignment, right? When they move the wrong way, they'll put a little bit of pinching pressure on a nerve. Now, whatever that nerve goes to is going to be affected. Right? And so people ask the question, well, how do my bones move the wrong way? The real answer is life. I bet y'all can tell me some stories. I know some of y'all have some crazy stories of how your bones move the wrong way. But the most common ones, car accidents. If you've ever been in a motor vehicle accident in your life, right? Sports injuries, different traumas, car accidents, sports injuries, poor posture is a big one. I played sports. I played football. Anyone out there played football? I played for 3 whole days. It was traumatic to my body. But another one is this. For a lot of people who sit at a desk, right, 8 hours a day, 5 days a week, it becomes your posture. So what happens is slowly over time, your posture that once started like this at your desk now starts going this way. And it puts pressure on the nerves that go to your neck, the ones that control the blood supply to your head. So here's a couple easy examples. #1, right off the top here, the bone right here at the very top that controls the blood supply to your head. And this picture right here, it's on our website. We can post the link in the comments here, but it controls the blood supply to your head. If you had pressure on the nerve that controlled the blood supply to your head and you left that there, typically what we'll see is something like a throbbing headache, right? Or migraine. If you've ever had a migraine before or know someone who's had a migraine before, my wife used to get them. I remember early on, before I was a chiropractor, before I knew any of this stuff, when she would get a migraine, she was sensitive to two things up there, light, and the other thing, sound, right? When patients come in, they're like 3 things, light, sound, and kids, which is also true. But you're sensitive. The reason why that happens, when you look at the chart here, the same nerve that controls the blood supply to your head, right below it, attached to it, is the nerves that control your eyes and your ears, right? Remember this. I need you all to hear this. Things are connected. It's not just bad luck. It's not always just bad genes and mom and dad's fault. Sometimes it is. Sometimes it's not. But more often than not, there's a root cause. There's a root cause. And if you can get to the cause of it, you can get rid of it, and you don't have to keep living with this stuff the rest of your life. Right? Here's another good example. Go down a little bit farther. Now you're in the middle of the neck. Right here, kind of towards the back here, but the nerves drive forward. Right around C6, the nerves go to your thyroid. Do y'all know your thyroid? Your thyroid, men and women have one. Women talk about theirs more. Men don't talk about their issues, but it's hormones. So your thyroid controls 2 things: energy hormones and weight loss hormones. Energy hormones and weight loss hormones. So if there's pressure on the nerve that goes to your thyroid can't produce the amount of hormone that it's supposed to. So energy goes down and weight goes up, and it's really hard to lose. This is the person who comes into our office and they're like, Dr. Nixon, I'm eating right, I'm exercising, I'm doing all the things that you talk about, the things that you teach. I'm trying to get better and nothing's working. I did Zumba, I did Tai Bo, I did it all. It's not helping. I eat broccoli. Why can't I lose weight? This is where we will look. This is where we look. Because the problem is, if you have pressure on the nerve that controls your thyroid, it can't actually produce the hormones. Even if I taught you how to eat right, even if I taught you how to detox, if you don't fix the cause, it won't get better. It won't get better. So one of the other things that happens is if the thyroid gets worse, you'll see something. You'll see the diagnosis called hypothyroidism. Hypothyroidism, and a lot of times the solution is levothyroxine or Synthroid, a medication, because if you can't make it, then you have to take it, right? They'll tell you this, you'll have to be on this the rest of your life. It's incurable. I want you to know that's not so. We have patients all the time in our office who are able to reverse hypothyroidism by fixing the cause, by fixing the nerve that controls the thyroid. I'm not treating and I'm not healing their thyroid. We're helping the thing that controls the thyroid. We're getting down to the root cause of it. So that's thyroid right there. If you keep going down, now you're at the very bottom of the neck where it becomes the upper back. Those are the nerves that come out across your shoulder blades all the way into your fingers. So this is where you'll see things like numbing, tingling. If you've ever heard of carpal tunnel before, is another big one we see walk into the office. But on the left-hand side, it's the same nerve roots that come out and control the heart. Your heart is a muscle. Your heart's a muscle. So if there's pressure on the nerve that goes to your heart, it makes your heart work harder. Your heart's an electrical system. It's why when someone has a heart attack, one of the first symptoms they see is pain radiating down their arm into their hand. Why? Because it's connected. It's connected. Right? High blood pressure right there. Keep going down. Now you're in the middle. There's a little organ called the pancreas. The pancreas makes insulin. It makes insulin, helps regulate your blood sugar. Right? So if there's pressure on the nerve that goes to the pancreas, it can't function at 100%. So it can't actually, via the autonomic nervous system, it can't tell the pancreas to produce enough insulin. So what happens is blood sugar goes up, insulin goes down. Doctor says, welcome to type 2 diabetes. Here's your metformin. Right? When that doesn't work, we'll try something else like Janumet. If that doesn't work, then you'll have to inject yourself with insulin. You'll be on it the rest of your life. Last one there at the bottom, those nerves go down at the lumbar spine to the muscles of the lower back. If there's pressure on the nerve that goes to the lower back, this is the person who feels low back pain. It's a tight or stiff muscle. If it goes down the leg, we call that one sciatica. It controls your knees, your hips, hip pain, knee pain. but the same nerves actually drive forward into the digestive system. So what we'll find is instead of a spastic muscle, you'll find something like a spastic colon. And then we just call it constipation or diarrhea or IBS. Go one higher, that's the nerve that drives into your stomach. A spastic stomach is when we put food in, it shoots it right back out. Doctor says, welcome to acid reflux. Here's a little purple pill called Nixon, and you'll take this one for the rest of your life. And I just want you guys to hear this. At the end of the day, with symptoms, I care about your symptoms, right? When a patient walks into me, this is the laundry list of things that we see walk in all the time. And I care deeply about the person's symptoms, but not because I want to manage them. I don't want to manage your mess. I want to help you understand the cause of it. If you can understand the cause, where it's coming from, then you actually have something you can work on. But remember, there's really 3 things we do at symptoms. I've found this over the years just from my experience, right? Again, I'm not trying to diagnose you or treat you, just trying to say from our experience, there's 3 things that we see. One is people will do nothing. Don't do nothing. The problem with doing nothing is it doesn't work a lot of times, right? If you just keep ignoring it, a lot of times it just keeps getting worse. So don't do that. So option 2 is where we go down the road of drugs and medications. And I get it. I promise you, if you're sitting there right now and you're in extreme pain, you're like, I don't care what it's called. I don't care what color it is. I'll take it because it can take the edge off, right? Medications can take the edge off, especially in pain, but it can take the edge off, but the problem is that it wears off. And as soon as it wears off, it's like, here I go again. I'm right back where I started. So option 3 is to actually get down to the root cause. If you can get down to the root cause of stuff, you can fix it. You don't have to keep living with these things the rest of your life. So, and I want to encourage you guys with this. When I say fix, when I talk about fix the cause, what I'm actually talking about is, remember we said earlier the problem was pressure on the nerves? So if that's the problem, the solution is to take pressure off, right? Take pressure off. So, because again, it's the brain is sending a message. If the message doesn't get through, then it can't actually communicate to the body. So if you fix the cause, take pressure off the nerve, allows your body to heal and to function how it's supposed to. Because we know our body can heal. Right, we know our bodies can heal. We knew that. We've always known that. That's not weird. That's not voodoo. That's not magic. It's simple. If you get a cut on your finger, what does your body do? It heals, whether you look at it or not. Right, like when Lincoln gets a little cut on his knee, we put a Band-Aid on it. The Band-Aid, we usually don't, but the Band-Aid just keeps dirt out. It doesn't heal it. The body is actually designed and created to heal itself, and it can. We just got to figure out why it's not. If we can figure out why it's not, understand root cause, we can get down to the bottom of it and get better. So I hope this was helpful. I hope it was encouraging. I hope it made sense. We're going to walk through some of the most common chiropractic questions that I got. We opened it up at the office recently, said, give us your questions, the skeptical ones, give us your questions. So if you have any questions right now, post them in the comments. We're going to jump through them. And I will say this, if there's anyone out there who listening to this, you're like, whoa, this makes sense. I think this chiropractic thing makes sense. Could this be the root cause of why I have headaches? Is this why I have migraines? Maybe you're suffering with thyroid issues or low back pain or sciatica or whatever it is. And if you're out there and you're someone who's like genuinely just looking for help, we'd love to help. We'd love to see if, hey, maybe this is a good fit. Maybe the cause is coming from the nervous system. And sometimes it's not. Sometimes it's more complicated or different, and it's not always the solution, but a lot of times it can be, or it could be a big piece of the puzzle for you. So if that's you and you've been looking for help, there's a couple ways you can connect with us. This is the easiest one. I've been doing this recently. I'm doing free consults virtually, either online or via the phone. I'll spend 15 minutes with you. I'm not trying to diagnose you over the phone, but just trying to have a conversation of, hey, what do you have going on? Could we be a good fit? What should be the next step? I just want to point you in the right direction. I'm not giving you a prescription. I'm just giving you a description of what might be the next step. So if that's you, feel free to take advantage of that. We'll post that in the comments. You'll find my calendar. Sometimes it fills up quickly, so just be patient with us. It's first come, first serve. So grab a time. I'd love to connect with you. It's completely free, no strings attached. Just for anyone out there who is honestly looking for help, when it comes to their health. We'd love to connect with you. So just find that in the comment section right there. So let's jump into some of the questions. All right, question number 1, does it hurt? Does an adjustment hurt? I like this question. This is good. It's a good question. So I'll give you a little bit of some of the stats. So there's at Twin City Health at our office, there's myself, Dr. Jessica Lee, and Dr. Tiffany Bradley. Those are our 2 associate doctors, and they are honestly incredible. So we did some math recently, and I mean, with 20 years of combined experience, we've done over, this is kind of a crazy number, over 100,000 adjustments. So adjustments in our office, we take a very just safe, non-invasive approach to it. So they're very safe. They're and just we go through so much training with a big goal of obviously, do no harm. I think that's every single doctor on the planet, right? Like, do no harm. But I will say, as people start getting adjusted, there can be the level of soreness, right? So soreness would be, think about if you hadn't worked out in months, and then you went to the gym and you're like, all right, I'm ready. I want to lose weight or whatever it is. Let's go work out. The next day, you're going to be what? Sore. So chiropractic adjustments in the beginning can feel like that because you're most likely, when people come in, they're trying to fix something that they may be injured 5, 10, sometimes decades earlier. And so in the beginning, you're moving things in a different direction and you can feel it. So does it hurt? No, it's safe in the sense of we're not trying to create pain. We don't create pain with the adjustments, but you can feel a level of soreness, just to be super clear with that. And there are cases where sometimes it can feel a little worse before it gets better. That can happen. And so it's definitely part of the healing process. But I think the easiest example of what it's like is maybe something like an exercise routine. I've also heard people make the analogy of braces. I never wore them. That's how I got a gap right there. But when you wear braces, you're moving bones. And so you can feel soreness, or maybe you describe it as pain, but maybe soreness, but at least there's purpose. If you're feeling the pain of it, at least there's purpose to it. You're trying to accomplish a goal. So not painful, can be sore. Hope that answers that question. Do I have to keep getting adjusted? Yeah, this is a super good question. Okay, so I think there's a couple different kind of trains of thoughts. And again, I'm just giving you our approach in our office. I'm not trying to say, we're better and all the other chiropractors are not better. This is not that at all, just our approach. And it's not a one size fits all kind of deal either. But the question being, do I have to keep getting adjusted? So I think the answer is no. In our office, we don't bind anybody to any contracts and you have to do this or else. I don't think that makes sense in anyone's health. I think for everyone, health is a journey. It's a process. And to be frank with you guys, I think the nervous system and the spine is just worth being taken care of. So a lot of times we'll walk someone through a process of trying to fix something or correct something that happened in their spine and their nervous system. So from there, you want to maintain that, right? We'll go back to the braces analogy. You wear the braces for a couple years in your teeth. They get the job done. They move your teeth. You got a beautiful smile. Then after that, you wear the thing called the retainer to maintain it. And so we'll do that with our patients, where it's easier to maintain their spinal health than it is to lose it and then fix it again. So a lot of times we'll walk patients through a process and then recommend maintenance care, either through adjustments in cooperation with some home exercises or spinal rehab exercises. I do believe, honestly, that lifetime chiropractic care is beneficial for so many reasons. Obviously, your brain and nervous system control every organ in your body, but even the research would even show, there's one that was done out of the Journal of Manipulative and Physiological Therapies, and it talked about patients who went to chiropractor for kind of regular or routine visits. They had a 43% decrease in hospital admissions. They were on 52% less pharmaceuticals. They had 52% less pharmaceutical costs and 43% fewer outpatient surgeries. And really, I think the testament would be you're taking care of the organ that controls the organs, right? So you're actually taking care of the thing that controls everything else. And so what happens, your body just functions at a higher rate, a higher capacity. has a higher ability to heal. So super good question. All right, next one. And if you guys have questions, post them in the comments. We'll get to them. Just post them right there. Any questions you have. Are all chiropractors the same? I went to one that did not take x-rays. Okay, great. Good question. There's to answer the first part, I don't think all chiropractors are necessarily the same. Dr. Jessica Lee, Dr. Tiffany Browley, and myself all went to the same chiropractic school down in Florida. But the reality is everyone who graduated from our school doesn't even practice necessarily the same. And again, this is not me saying I'm better and everyone else is worse, but our approach, I try to take a pretty systematic approach, or one where you can measure outcomes. Right? I really believe that measuring outcomes can be helpful. So we obviously we don't radiate every single person who walks through our doors. There is the responsibility to mitigate risk and only take x-rays when they're appropriate and necessary. So we do that. So if you went to a chiropractor who didn't take them, maybe they just didn't think they were warranted for whatever reason. And again, that's not right or wrong. That's just, again, their approach. So, but if someone has a spinal injury, chances are I want to see it. I want to know what I'm working with if I'm going to be taking care of it. And then also, am I fixing something, right? Are there measurable outcomes? So one of the ways to do that with maybe a scoliosis patient would be a pre and post x-ray. Is there a way to see a measurable outcome in the spine? Or if someone's telling you, hey, this is misaligned or crooked or wrong, is there a process to actually get me better? And is there a process to take maybe another exam or another follow-up x-ray to do that? That's our approach in our office. So again, I'm not trying to say good or bad chiropractor, just saying for me, at least in our office, I prefer to know what I'm looking at. I think it's helpful, especially if it's warranted. And so that's kind of what the way we approach those things. So great question. Awesome. Okay, next one. Why does it pop sometimes when I get adjusted and sometimes it doesn't? That's a good question. So the pop is called a cavitation. When you pop like your knuckles, the same thing. It's a gas exchange, almost like this vacuum effect that happens. The pop does not mean that the adjustment was good or bad. I can foam roll on my back at the gym and I can make things pop. It doesn't mean I'm bringing things into alignment or out of alignment. It's just gas exchange. So that's great. So sometimes it can, sometimes it doesn't. It doesn't mean it's good or bad either way. So great. Next one here. How does chiropractic help with ADD and ADHD? Yeah, super good question. Okay, so let me say this. Whenever anyone asks, how does chiropractic help, I'll always just point them back to not necessarily my anecdotal experience first, but more so the neurology, right? So the nerves that control the issue that we see oftentimes with ADD and ADHD, and again, there are going to be so many causes of hyperactivity, but neurologically, one of the ones we see is from the very top bone in the spine. It's called your atlas bone, and it controls your sympathetic nervous system. Sympathetic nervous system is your fight or flight mode. So when this nerve or nervous system part gets triggered, right? Imagine taking a gas pedal and flooring it, right? That part gets triggered. The kiddo or adult will go into a fight or flight response. So what that feels like is it can raise blood pressure. It can increase lung respiration rate. It can decrease their digestive system. It makes it really hard to synapse or to connect your neurotransmitters. So that would be serotonin and melatonin and dopamine. So it's hard to think. It's hard to focus. Everything's going on in my brain and I'm trying to take a test. That's really hard for anybody, but especially for a kiddo. So if someone comes in and they're maybe looking for help with ADD or ADHD, we'll always start by looking at the top bone. And if there's an issue there, then we'll move forward. And if there's not, there's not. You know, I'll tell the patient or the parents it's not. We'll be straight with you guys. But if it is, then we have something to actually start working on. So when you start adjusting this part of the body, and obviously you would look at that through an x-ray, right? So we don't radiate babies and infants, you know what I mean? But if we have an older kid and we take an x-ray, we're looking for what's going on, what's misaligned, and the x-rays also help us understand what we're adjusting. It helps us understand what we're adjusting. So we start working on that, and it stimulates the opposite effect, which is called the parasympathetic nervous system, which is your rest and digest centers. And so a lot of times in kiddos who have been diagnosed with ADD or ADHD, we can start turning on the parasympathetic nervous system response, and we see they're able to focus. They're able to pay attention. In a lot of cases, we've seen kiddos who their parents have worked with their primary care doctor who've been able to reduce their medications. I don't put people on medications. I don't take people off medications ever. We always have our patients work with their doctors. And so when they're doing better, feeling better, and they're healing, they don't need as much help on the medication side. They're able to heal naturally. So I hope that's helpful. There's a lot more to it, and there's a lot more even on the scientific side for ADD and ADHD. For anyone out there who loves research, if you want any, let me know. I'd be more than happy to share some of my resources with you guys. So cool. Next question. How does chiropractic help newborns? Okay, cool. So this is fun. We take care of a lot of babies in our office. And so the most common ones, I think that come in, flathead, plagioccephaly is a big one. We'll see kiddos who maybe through the birthing process, there's the extreme one would be called torticollis, right? So there's a lot of chiropractic care and adjustments you can do, gentle adjustments. We don't do the twisty neck thing, but we just slowly release that and align the bones there. That's a really common one. If kiddos have a hard time latching or nursing on a certain side, a lot of times that can be due to an issue, a misalignment in their cervical spine or in their neck that doesn't let them rotate a certain way. So we help with that. Tummy time's a big one. If a kiddo's having an issue when they're on their tummy, they get really fussy, they get mad, they scream, and they can't extend or lift their head. And it also prevents them from crawling. A lot of times that can be a misalignment at the occiput or the base of the skull. So we'll look there. There is extra training. In school, we learn about pediatrics. And then for myself and Dr. Jessica Lee and Dr. Tiffany Bradley, the other two doctors here, we've done some other extra training for pregnant moms and for babies. So I think that if you are considering a chiropractor for your infant, just ask the hard questions to the staff or to the doctor. Do you guys see infants? Do you guys adjust babies? What do you help them with? How often do you see babies in your clinic? Just to get a good grid. I feel like that's what I would do as a parent. There's a lot of great chiropractors, even just in our community and across the country who are versed in adjusting babies. So if you have a kiddo who's dealing with any of those things, I highly encourage you to get down to the root cause of it and see if chiropractic can help. Another one that we see walk in all the time is actually acid reflux. We'll see babies, infants who are months old on medications like Prilosec. I've seen them come in on Nexium before, and a lot of times we can get down to the cause of it being somewhere in their middle thoracic spine is the nerve that goes to their stomach. And so like I said earlier, if there's pressure on that nerve, the valve for the stomach can't function properly. It can't open and close how it's supposed to. And so what happens is it'll shoot food up. And they can create distension and gas and bloating, and the baby is so fussy. And a lot of times mom tries to change the formula, which is great, but fixing the cause, they can actually digest it and ultimately get off of the medications, the reflux medications. So with babies and newborns, that's what we see a lot. We work with a lot of the different nurses who actually work at birthing centers here locally, and we'll see once in a while there's a birth that might require extra help, and that's no fault of anyone. That's not fault of mom or anyone, but if they have to use forceps or some sort of vacuum to get the baby out, or even just pulling really hard, that can cause trauma to the upper cervical spine. So we'll see newborns or infants after what we would call maybe a traumatic birth, or a birth where a baby got stuck and they come out with maybe indentions in the head, so we can work on the sutures to help with that. So I hope that's helpful when it comes to newborns and babies. Cool. All right. Yep. There's the link one more time. Well, let's do this. Let's, I I put that in twice. There's my team. Hey, let's open up the Q&A. So if you have questions, I want to answer them. I don't know everything, obviously, but I want to help where I can. So if you have any questions, post them in the comments. Ashley, if there's any questions, you can bring them up for me. This is my amazing team. They are awesome. They're incredible. They've been with us, some for a year or so, some for many years, and so thankful for them. So cool. What about type 1 diabetes? Yeah, let me answer this. And I had a couple other ones come through as well. Whenever anyone asks the question, what about blank? My answer will always be, if it's coming from the nervous system, we might be able to help. That's where we would start, right? So with type 1 diabetes, obviously it's different than type 2. And this is important for people to understand and to know. Type 1 is actually an autoimmune. It's actually an autoimmune condition. And it typically will start early on in someone's life. So we've seen, just anecdotally, we've seen good results with kiddos who've come in, who've been diagnosed type 1 diabetic, and being able to reduce the load of insulin that they're on. I've never, and this is true transparency, I've never had a type 1 diabetic patient be able to completely get off of all their insulin. We've had several patients, I mean, for the ones who have come in with type 1 diabetes, a good handful of patients being able to reduce their insulin, but there's an autoimmune component to where the body actually attacks part of the pancreas. It's different than type 2. Remember, type 2, a lot of times the doctor will say, oh, eat better, right, and exercise, right? Because type 2 diabetes is what we say, it's more metabolically induced. So eat better, exercise, that's what we want you to do. And I agree with those things. I teach those things, but the problem is that's not the cause. Because the problem is we know people who eat worse, who don't exercise. They might weigh 200 pounds more than someone who's been diagnosed with diabetes, but they don't have it. And they're not on the medications. Their A1C isn't as high. And so it's not the cause, right? Or if the doctor says, oh, it's your genetics, that's another one. With heart disease, with type 2 diabetes, they are not purely genetic. What is genetic is the color of my eyes. They're brown or hazel, maybe, but they're brown. I was born with brown eyes. I wasn't born with type 2 diabetes, right? You weren't born with high blood pressure. It's not purely genetic. You may have the gene for it. That's called epigenetics. Your genes are like a light switch, and something has to turn it on. The good news is something can turn it on. The other good news is you can also turn it what? Off. And we start with the nervous system, the thing that controls that organ. So that's the difference between type 1 and type 2 diabetes. Great question. I saw one up there about concussion. Can you put that back up for me? Can you help with post-concussion syndrome? Okay, great. All right, so good question. When I hear this, I think my soccer players, I think my football players, anyone who's ever suffered a concussion. Obviously, you can get a concussion so many other ways than that, but those are probably some of the most common ones we see walk in. Here's the problem. One of the things that they will tell you after you have a concussion, they'll say this: once you have one, you're more likely to have what? More, or another one. You're more susceptible. It's going to be easier. And a lot of times the reason would be is because you never fixed the damage that happened from the first one. And when I say damage, what I'm talking about is the misalignment to the top bone. The top bone, C1, if you look back at that chart, if you go to our website, you can see it there, twincityhealth.com, but the chart talks about the blood supply to your brain. So when you have a concussion, a lot of times what we see is a diminished amount of blood supply to the brain, but the bone actually can move or misalign. And if it stays misaligned, you'll have a higher tendency to things like headaches, nausea, dizziness, even anxiety. The neurotransmitters are controlled through there. So a lot of times with post-concussion patients, there's a multi-level process, but on the chiropractic side, we start with the upper part, C1, C2. That's the blood supply to your brain. From there, there's other things on the nutraceutical side. Fish oil. Your brain is made of EPA and DHA. I mean, we've seen research 70 to 75 to 80% of your brain is made of fat. So if you're trying to recuperate brain tissue, healthy fats, consuming fish oil, fermented cod liver oil, is going to be helpful. But just from the chiropractic side, C1, C2, there are certain chiropractors who only adjust C1 and C2. It's called an upper cervical chiropractor. I am not one of those per se, but we adjust full spine, the entire part of the nervous system, but we look at C1 and C2 for all of our post-concussion patients. So thanks for that question. I hope that's helpful for you. I hope that made sense. Cool. What else we got? I have one that came in. Someone had asked about incontinence. How does chiropractic care, or can chiropractic care help with incontinence? And so I'll walk through that. So with the incontinence, it's the bladder. We see this in a couple ways. We'll see it in kiddos, and then we'll also see it in postpartum. So neurologically, the nerve that controls the bladder is down by L3. That's what we'll look. And then postpartum is obviously your ligaments have changed a lot after you deliver a baby. And so after a baby is born with mom, we'll do some specific adjustments to stimulate the integrity or structure of her pelvis, right? The word would be stability. Kegel exercises would do this. There's chiropractic adjustments that can do that as well. So great question. I love that one. Here's another one. Someone had brought up the question, how do you handle chiropractic care for someone with a prior neck muscle injury and scoliosis? Okay, good question. And okay, let me try and put this together. So, and again, I don't know, everyone's full health history and all that stuff, but so scoliosis in itself, let me just start there. Before I moved to North Carolina, down in Florida, the only thing I did was scoliosis. So I'm versed in it. It was probably the hardest thing I ever did. I ran, it was a Clear Institute Scoliosis Reduction Center. So we had kiddos, usually 12 to 14 years old, usually girls, female, would fly down to Florida, and we'd have about 2 weeks to reduce their scoliosis to under 50 degrees. So 0 would be normal. At 50, they schedule you for rod surgery. Right? And the reason why is usually not because of pain, but because even in the orthopedic world, we know that a 50-degree scoliosis puts so much tremendous pressure on your heart and your lung cavity. So they'll do an extreme surgery to take pressure off of it. That's how important the nervous system is. So, but I'm versed in scoliosis. So when someone has maybe a neck injury and they have scoliosis, I think I would treat it the same way that if they had a neck injury without scoliosis, and it would be to first see what happened, right? So I hurt myself. I fell down the stairs. I turned too fast in my car. I have a neck injury. It's pulling. If I have scoliosis, it's probably going to make it worse, or it's going to make it harder to heal, right? But I think the ultimate goal would be to reduce whatever type of misalignment happened, would be to reduce that. So with scoliosis, the big difference is you can't just take someone who has scoliosis and push them straight. The spine doesn't actually work that way. The research would show time and time again, scoliosis is more about rotation. It's more about rotation. So if you can reduce the rotation of the spine with a scoliotic patient, you can actually a lot of times stop it from progressing. And a lot of times we'll even see reduction of the curve. So not saying completely, miracle and make it go back completely straight, but stop it from getting worse, and even reducing it would be a big win for someone who had any type of neck injury or muscle injury with a scoliosis curve. So good, great question. I like that one. That was great. Next one. Other questions? Cool. All right. Awesome. Hey, Lynn. Thanks for posting questions, and we'll just take a couple more if you have any. Thanks so much for joining in again. But if you have any other last questions, shoot them in there. Let me do this one here. Bunions. Can you help with bunions? Hey, good question. All right. So depending on, again, how progressed it is, it's worth a shot to look higher up the kinetic chain. What that means is obviously a bunion's in your foot, but if you can trace it back to maybe a hip or pelvis misalignment, you may find some of the cause. Obviously, bunions can be caused by wearing, pointy shoes. It could be one of the causes. But if you can look up higher in the kinetic chain, maybe find some of the misalignments in the hips and pelvis, resolve those. A lot of times, bunions might be able to get better. There's also another thing that I love recommending. It's called yoga toes. I know that sounds weird. That's not chiropractic. It's just something I want to help you with. So if you have a bunion, go Google yoga toes, and that might be able to help you. Cool. Last question here. Can chiropractic help with skin issues and acne? Awesome. Good question. All right. More often than not, when someone comes in with acne or skin issues, a lot of times it's a reflection of their gut. What happens is if you can't get food particles out of your digestive system, if you're not having normal bowel movements, if it can't come out through your bowels, a lot of times it'll come out through your skin, through your pores. All right, so we'll see that oftentimes as acne. There's another version called skin eruptions. So if you look at the chart there at C3, cervical spine and your neck, at number 3, you'll see eczema and skin eruptions. A lot of times that comes from a misalignment in the upper cervical spine, and it creates an inflammatory response. This is if someone has skin eruptions on their face, or if they get eczema on their eyes, under here, or on their mouth. Eczema on the face, we'll look at C3 for the root cause of that. Or again, the most common one would be if someone comes with acne, I'll ask them questions about their lower back and about their digestive system. And a lot of times if the digestive system isn't emptying properly, it's coming out through their skin. So if you can fix that, right, fix the nerves that control the bowels, get those moving properly and normally, a lot of times the acne will clear up on its own. So good question. Really, really good question. So I hope this was helpful. I love you guys so much. If you have any other questions, comments, concerns, anything I can help you with, let me know. And again, find my link if you want to connect and spend some time, 10, 15 minutes together. I'd love to help serve you guys in any way that I can. We're here for you. My team is here for you. We love you guys. We want you to experience your God-given health potential. We really believe that you were designed for health and for wholeness, and that means to be whole, mind, body, and spirit. Just remember, health is a journey. It's a process. You're worth it. Your body was created to heal, but it's both, right? It's us knowing that, and it's us taking action towards our health. You're the only one responsible for your health. I can't do it all for you, but I do want to be here to serve you along the way. Love you guys so much. Have a blessed one, and I'll see you guys next time. Again, this was Dr. Nixon with Twin City Health.